Hi everyone, I hope everyone can hear me. My name is Vicky McDonald and I'm the communications and marketing person behind Homes for Cathy. So good morning and welcome to our today's hour-long workshop on a psychologically informed approach to homelessness and housing. I've just seen a good morning there, so that's nice. I can actually know that someone's out there, which is always encouraging. If anyone else wants to say good morning, it'd be nice to hear from you. So it's great that so many of you have joined us today. I think about 160 people actually registered, so you know, it's an excellent turnout. It's a really amazing number for Homes for Cathy. So as I said, I work for Homes for Cathy, but I'm actually employed by Hightown as their social impact coordinator, and Hightown is obviously a Homes for Cathy member. We're based in Hemel in Hertfordshire, and today I'm joined by two wonderful Homes for Cathy members. We have Seini Haynes, who is the lead supported housing manager at Sovereign Housing, and Lee Buss-Blair, who is the director of operations at Riverside. So Seini, giving us a wave. So Seini and Lee are going to share their insights into psychologically informed approaches and how they've been adopted not only in supported housing, but in Riverside's case, organisation-wide, and that's a part of a process that they're just going through now. And there is another colleague of mine in the background, Nicola, who's going to help with some of the Q&As because there's quite a lot to manage on the technical side. Before we start, just wanted to say that this session is going to be recorded and put on our YouTube channel. And as you've probably appreciated, we're running this event as a webinar today because there's so many people. So everyone's on mute. So hi from David Bogle. Hello, David, from Hightown. But there will be an opportunity to ask questions at the bottom. So I see everyone is using the chat. But there is also, if you look on the bottom, there should be a Q&A button where you'll be able to see what questions people have asked. So people can type in questions throughout the session, and you can also upvote other people's questions. So there's a tick box there, and I believe that this is the first way I've done it in a webinar that you can actually upvote other people's questions. But if anyone's got a burning desire to ask a question out loud, then that is also possible. You can raise your hand. There's a little raise hand button at the bottom, and I will try and look for people that might want to ask a question out loud. I don't think we see your faces, we just hear your voices. Hopefully, if you could ask questions, because it would be good to have some good discussion, then that would be really appreciated at the end of the session after both Seini and Lee have spoken. So before we move on to Seini and Lee, I just wanted to give an overview of Homes for Cathy, because I appreciate that not everyone who's joining today is a member, but it's great to see you. But just to give a little brief overview, so we're an alliance of just under 120 housing associations, so predominantly housing associations, but also charities, small homelessness charities. A lot of them have joined the group, which is great. We're formed back in 2016, and we're all committed to ending homelessness, basically, which is why we've come together. Sorry, someone's just ringing me, just slightly off-putting. So basically, we work with Crisis to come up with 9 commitments that all our members used as a benchmark for the best practice within their organisations. And also we share best practice as well. So that's obviously why we're here today. If you want to have a look on our website, you can see the commitments there's a commitments tab. But I think psychologically informed approaches are key to 2 of our commitments with Homes for Cathy. So the most obvious one is really the need to meet the needs of vulnerable tenant groups, which is obviously important because many of those have experienced some form of trauma in the past. So trauma-informed care is vital in that respect. But also thinking about the needs of tenants that want to prevent their homelessness. So one of our commitments is to not make any tenant seeking to prevent their homelessness homeless. And I think that's really important to, appreciate, what people are going through. And I think, the pandemic has brought on that more sort of person-centered approach, even if organisations aren't doing it in a formal way, perhaps such as Riverside, they're maybe doing it more informally. And I think, that is key to having a successful tenancy. So that's one of the reasons why I thought it would be a good subject to cover at the moment. So before I waffle on too long, I'd like to introduce my first speaker, Seini Haynes from Sovereign.
Thank you. Good morning. And sorry, I'm also just trying to adjust and figure out how to keep the Zoom on my screen whilst looking through my presentation so that I don't forget to pay attention to how I'm looking whilst I'm talking. So do excuse me if I look a bit perplexed. So well, let me just get. So morning, my name's Seini Haynes and I work for Sovereign Housing, and we were invited to talk about our journey towards psychologically informed environments and how that's influenced and shaped some of the services that we're delivering now already and those that we're creating for the future. So on my next slide, we're just a little bit of information about Sovereign and who we are. For those of you who don't know, we're located across the southwest of England, and we're delivering about 60,000 homes across the south. So we have the usual range of in our offer: a social rented, market rented, shared ownership, outright sales, some allocation to key worker homes that has its own specialist team, and we're building and developing around 1,900 new homes a year over those areas. So our area is geographically broad, but one thing that I would say is that we don't tend to hold large amounts of stock in big city centres. We're more market towns and rural areas across our distribution. So we do have some areas like Bristol, Exeter, Southampton and Bournemouth where we're operating some services, so they differ slightly. And we have a specialist supported housing team covering around 1,300 homes. So in terms of our supported housing offer, we, and that's on our next slide, we're working cross-divisionally and serving the whole of the geography covered by Sovereign. And I was trying to look at the number of local authorities, and I think it's somewhere in the region of about 140, but I don't know the exact number. But when we crystallise things really and distill it down, we have really 4 distinct product offers. And they are extra care housing, which we operate in Plymouth, Andover, Abingdon, North Devon and Hungerford. And they are purpose-built facilities, so that's great. And we partner care providers delivering those services. Our supported housing stock ranges from individual properties or schemes, and they're very varied in size and location. And we work alongside sort of more specialist support providers. We deliver direct housing management, and we also have a range of properties where we work with specialist providers who want to deliver housing management, and we support them to do that. The client groups cover all of the usual mental health, learning disability, young people, domestic abuse, so the full range really. And then the next offer that we have is Housing First, and that's something that's grown in the last probably 2.5 years, or we're just entering our 3rd year of service delivery of Housing First. So working in partnership with our local authorities, and a specific support provider offering homes for those most in need with a history of rough sleeping. And we're really excited about that one because we've got a Housing First for Youth project, which is about to go live in Gloucestershire. And lastly, our temporary accommodation services, and that's probably where we'll get to with today's conversation about kind of what we're developing under sort of more psychologically informed environments. So we've created an offer for temporary accommodation, which is a slightly different offer for local authorities to replace or to have an alternative offer towards bed and breakfast. But we also deliver a temporary accommodation service at our foyer on the Isle of Wight, a big 45-bed service for young people aged 16 to 30, and then Nova and Blackdown, which I'll talk a little bit more about, which are our new services for people who've experienced homelessness. Okay, so in terms of how did we get to kind of wanting to deliver more psychologically informed services, I suppose over the last 3 to 4 years, we started to see a real combination of changes that shaped the future for us, and particularly for supported housing. There was clearly a much more direct focus around the rough sleeping strategy and the Homelessness Reduction Act kind of meant that our local authorities were dealing differently with people who were approaching them as homeless, but also in how they were asking us to work with them. But also at the same time within Sovereign, our leadership changed, and that there was a bit of a cultural shift, and we were able to place more emphasis on homelessness, which was fantastic for us in our supported housing team, because many of us come from backgrounds working in homelessness and rough sleeping. But certainly in our strategy, we talk about providing more opportunities for those who need them and for doing the difficult, and this really lent itself to that. So and the other things that we saw was that externally support providers were starting to be really affected by cuts in their grant funding and revenue streams, and handing us back buildings and that we were looking to repurpose. So all of those things really combined to think about, you know, what we do in supported housing, the how and the where and the why. And we started to challenge ourselves about what it would mean to deliver really great services and meet the needs of customers. You know, and recognising that homelessness and people who've slept rough would feature quite highly in those plans. And that led us really to our association with Homes for Kathy, and we came along to one of the conferences. We'd had some conversations and shared a bit of information about some of the work that we were doing. And so we talked a bit about our temporary accommodation offer, and how we wanted that to be different. And exploring what we could do to enhance that. And we came to the Homes for Kathy forum thinking about where our next steps might take us and looking for some inspiration. And there was a real moment of clarity for us we came to one of the events and we got to see a documentary that was created by a young woman who was living in temporary accommodation at the time. But what it is a young lady called Daisy May Hudson, who documented the experience of her and her mother and her sister as they were transitioning. They lived in private rented accommodation, became homeless, and had to approach their local authority, and they were then sent to temporary accommodation. And it's about the experience that they had. And it really resonated with us because we had already started to develop some temporary accommodation models that we felt were great, but needed some development. But it really focused our thinking about what our customer experiences when they come to us and how we could perhaps shape that to improve our offer. So let me just find where I am with my notes. So it was a really powerful piece of documentary. We found it really exciting, inspiring, and also that we wanted to go away and make some changes. And that really made us go away and explore trauma-informed approach and psychologically informed environments. And so that was our starting point. That was the environment that we were operating in, and that was the motivator for us to go away and think. So we went away and we started to look for training. We knew we needed to do more, and we felt we wanted to look around and see what we could do differently. The first thing we did was started to look for training. We spoke to our colleagues at Homeless Link about our needs, and they really sourced us some credible trainers that came and delivered sessions for us. And we were able to really influence how that training was. We were really open and honest about our services, what we deliver, and where we felt we were, and where we felt our teams were, and they were able to build training for us that was really bespoke. We made sure that our management team were part of that training, because changing the culture of how we work would need that kind of influence, and it really paid dividends much later on when we were coming back and asking for different resources and for our services. So we included all of our management team and onboarded them. And since then, we've recognised the need that has to form part of our housing passport for supported housing colleagues, really. Well, not just supported housing, but we'll come on to that. But so we've set up a programme to deliver that training around what it means to operate psychologically informed environments and practice with a trauma-informed approach. And we run those very frequently. And then additionally, I think in some of our services where they are exposed to more trauma, we've implemented clinical supervision so that we're able to address vicarious trauma for our colleagues in a really safe way, and provide that space for them to consider their own well-being. In terms of the physical environment and social spaces under a psychologically informed environments. We wanted to create really light sort of modern spaces and reflect the aspirations that we have for our customers. So we set up a project team that worked with some of our customers in supported housing and asked them how they felt services should look and what should be provided. And in all of our temporary accommodation services now, we provide really simple things that make a huge difference. There's always new bedding and new towels that are allocated to each person. The beds are always made up on arrival. Rooms are always properly cleaned. We don't expect people to deal with missing or broken items. We check every room before it's let. We provide some soft stuff like a toiletry pack or a basic food provision to get people started. Because we just really felt that we wanted people to arrive and feel safe and be able to sit down and make a cup of tea straight away and feel as safe and secure as they could be in the environment, in what would be an unfamiliar environment for them. But our project team created a furniture standard, and that specifies exactly what's needed in each service. And they went into finding various products that met the standard style and quality that we were looking for to create a bit more of a catalogue for us to create that consistency in our services. And in terms of using the physical environment and social spaces, in some of our services like the foyer, it means that we really think now about what impact we have for people when they first arrive and we receive them for induction. We choose appropriate spaces for them. We might scan the information that we have to understand if there's something that's needed, like a hearing loop or disabled access. We pre-plan as much of that as we can to make sure that the experience is as positive as possible and people feel as safe as possible coming into our service. We did a bit of stuff around removing things like some of the signage that stamps our ownership on service, that constantly reminds people that they're in somebody else's building and that there's a landlord presence, and we've tried to really soften that as well. And then, sorry, just moving on to my next slide, the principles that we applied in terms of a psychological framework. Well, they're the standard things that I'm sure all of you are looking at or delivering perhaps. So adopting a trauma lens, recognizing the work that we do with customers that have experienced adverse childhood experience or multiple complex traumas. And we already work in that way. Everybody who works in supported housing is coming into contact, and in general needs housing even, but are coming into contact with people who've experienced those issues. But we've really been able to sharpen our focus on understanding our reactions and the behaviours that we see, and working in a way that's designed to place the customer at the centre. And so sometimes we think outside of our policies and procedures and don't allow them to dictate how we're working with the customer. Right, for an intervention to happen or for us to work in a different way, then we'll create the rationale for that. We talk about demonstrating elasticity in our tolerance, and that's about having that flexibility to the understanding that people behave in a way, or you might experience reactions that but we try to stay aligned to the principles of what we can offer and that what we can offer safely. We talk a bit more about safety planning. I'm sorry, sorry, before I do that, we talk a bit more about advantage thinking or strengths-based approach, because we really committed to that approach in our foyer on the Isle of Wight. And we underwent a year-long accreditation with the Foyer Federation, which asked us to review all the aspects of how we work, our policies, our procedures, our forms. And at the beginning, we felt that we had a really good handle of it and that it would be really easy for us, but it has been a real process of change for us. And we've learned so much along the way. We've changed the way we work around referral, assessment, sign up, induction, onboarding, support, and safety planning. Everything we do has been changed to consider strengths first. And we recently received our accreditation and commendations about the strength and quality of that service. We remove, I talked again about the power differential. We try not to take a parental approach. We're respectful and adult in our transactions, and we share the space with the customers in our service and aim to move alongside them rather than that feeling that we're there to manage them all the time. A touch on safety planning as part of what we do. I think I've worked in supported housing and homelessness for a really long time, and I'm familiar with those meetings that you started with residents, where you would go through countless forms and you would really asked some quite intrusive questions because you felt it was justified, because you needed to understand the risk of that person and what that meant for the service and for other people and for them. And we've really changed how we work that, and safety undoubtedly remains incredibly important and at the centre of what we do. There's no getting away from that, but we've adjusted to creating safety plans, exploring what's worked really well for the customer, and how we can really dial up the things that they know work well for them, asking them what works for them, asking them how they would like us to respond in situations where risk may present, and just moving away from focusing on them as being part of the risk. And choice and control, really just kind of going back to what I've already talked about, offering choice and control and support to receive the outcomes that support the outcomes that come from that, regardless of what our own expectations are about what those young people or those customers should be doing. So I just really quickly want to kind of wrap back around to the services that we've just started to deliver. So we're on slide 9, Vicky, if you're not kind of up where I am. We've just been able to open and are about to open the adjoining services to this new scheme that which is a range of 3 properties offering 9 bed spaces, and they're located in Basingstoke, quite close together, and we created them in partnership with the local authority, utilising some NSAP and RSAP funding, and offering accommodation to those with previous experience of homelessness or rough sleeping. And the service came about because we had supported properties that were handed back to us because of the conclusion of support funding. And we saw it as an opportunity to do something new, and we talked to the local authority about what they needed. We looked at where there were gaps in service provision, and we identified that there was a need for non-hostel based single person supported accommodation. And we know that hostel accommodation can often feel very chaotic and regimented for people who experience homelessness. And we know that, you know, and we probably can't get through anything today without making reference to COVID, but the drive around self-contained accommodation feels like you know, there's much more pressure to create self-contained spaces. But we wanted to reflect that that wasn't right for everybody, because for some people, having time spent on the streets or living on their own can be really an isolating and lonely experience. And also for people under the age of 35, self-contained accommodation often isn't a viable option because of affordability. And so we wanted to create these homely environments that would give people the opportunity to move on and live in shared accommodation. Okay, sorry. Okay, where am I? Okay, so in terms of the philosophy of that service, then the project is the first of its kind in the area, and the key to the model is the way it's been developed and delivered. So peer mentors with lived experience from our partner Outcome Home have been a really key part of our project team from the start. They've had input in every stage of what would work for clients, from the locations and layouts of the property, from furnishing, agreeing the processes and approaches, and their lived experience has really led the way with that. They're also part of delivering the support service, with their understanding of what it's like to be homeless. They're able to support, advise and befriend those with multiple disadvantages, and enable better engagement with our service. So they've been involved in the setup, forming the balance and meeting individual needs, meeting possible residents and considering the dynamics of the household, explaining the offer to them in very real terms, helping the cohort, the people, the residents, the customers living in that home to develop house rules that are right for them, and continuing to kind of review how that works. Rules get broken sometimes, and talking to them about how they as a group want to deal with that in their home, rather than us as a landlord saying these are the rules that everybody follows in our shared accommodation. It's what's right for that particular group of people. So giving them a real sense of shared accountability and choice and control, and asking them to respond to change, things like where rules are broken. So we've created that kind of psychologically informed approach right from the beginning, and through to the service delivery. We try to take into account the psychological makeup and the thinking emotions of everybody in the service. just so we use them. Okay, I've talked a little bit more. Talked about this for the foyer, but we use a more conversational approach around induction. So we opt not to go into big form filling exercises. We try to hold a much more sensible conversation, talk about what the service offers and whether the customer feels that that's the right match for them. A little bit about the environment. So we've furnished them to a really high standard, and I'm really sorry that I haven't been able to include pictures in the presentation today, but what I will do is add them in so that if the presentation is sent out, then you can see, you get a bit of a sense of what they actually look like. But they are furnished to a fantastically high standard that any person, a group of young professionals living together in a shared home would expect to see. Light, bright, modern, homely, warm. Obviously we've incorporated the choices that people have made into those. We've given consideration to creating social spaces, so having a shared kitchen and diner and creating enough room for people to cook and eat together if they wish to, but also enough spaces for there to be privacy. One of the layouts of the buildings, we wanted there to we had to purpose one of the rooms the lounge became a bedroom, and we've just done a project to completely convert the garage into a social space. And the existing customer group there told us that they wanted a pool table and a sofa in there, and that's basically what we've been able to provide. So listening to what they actually want through their home. And the other thing that's really important that we in all of the services is that they're really well equipped, and they have Wi-Fi throughout. And we reckon that was one of the things that came out top as being really important that people wanted to see in our services. So our role in that, then, we provide an enhanced housing management service and some support, which is delivered by the peer mentors. And every resident or customer has access to up to 4 hours of support each week, which is really flexible. And we also have a range of online tenancy training and employment training skills that people can access and get some certifications to help them as part of their journey towards moving on. And those are so that's our new services in Basingstoke, which are just about to go fully live, and we're really proud of how they've been created in partnership and what we think that they can deliver by working in that really psychologically informed way. I guess the last part that I would talk about is that from Sovereign's point of view, in our supported housing service, we picked up the thread of pie and tick from the work that we were doing around homelessness and temporary accommodation, and we started to develop our approach to that ourselves. And it was a little bit it was completely in isolation from the wider business. As we've grown, I think we've learned that there are some more natural conflicts in the way that we deliver and our processes, and so we see that there will be benefits for if we could extend and grow that culture around services like our ASB and our lettings and communities team. And our hope is that we can shift that culture. And when I talked at the beginning about that the importance of having leaders as part of the training, that means that understanding that they have is embedded right from the start, and hopefully we're making some inroads into how this could really impact all of our customers, not just those in supported housing, if we can help guide the rest of the business through this journey. We know that we've developed some stuff in isolation from other providers, and so there's still a natural lean towards things like people wanting to fill out forms and risk assessments and sort of a bit of inflexibility or a sense of ownership about buildings and services. But overall, we're seeing that there's lots of change. We work as part of a number of different pathways, and most providers that we work with are working towards achieving sort of the same sort of standards. The other things that I'd say is, as I've referred to, is the influence is getting the right people involved in your organisation to really help influence that culture, and the resources. There's clearly there's been places where we've spent quite a bit of money in making sure that the standard of accommodation is right, and so getting the business to commit to that needs some influence. So the right people and commitment to the right resources. And really, that's probably all I had to cover. I don't know if I've whizzed through it a little bit too quickly. And I think that the opportunity for questions is at the end of the presentation. So if it's okay, I'll hand back to you, Vicky.
Thank you, Seini. That was an excellent insight into what you're doing at Sovereign, and really great to hear that you were inspired by a Homes for Cathy event. But for anyone who's interested in reading a bit more about the work with Sovereign and Outcome Star, there is an article on the Homes for Cathy website which goes into a bit more detail, and also an interview with one of the peer mentors who took part. But I think it's really interesting that, you know, your move on accommodation, as you said, is you know, would be fit for any young professional to move into, and I think that's the key, really. So thanks for talking about that, and we'll be able to answer questions, as you said, at the end of the session. So now I'd like to introduce Lee Buss-Blair, who is Operations Director at Riverside, and Lee will talk a bit about their approach.
Thanks, Vicky. First of all, I need to apologise. It seems that my neighbour has decided that today is the day to get the chainsaw out in his garden. So if you can hear something in the background, I apologise. Let me just share my screen. Okay. So my name's Lee Buss-Blair. I'm recently married. I keep forgetting the last bit. Don't tell my husband. We'll keep that a secret. And I'm the Director of Operations for Riverside, overseeing our care and support function. I'm also the Group Veterans Lead as well, for anyone that's interested in that part of the sector. So, just 1 second. Try that again. Oh, there we go. Obligatory. Who are Riverside slide. We all have to do them. That's Riverside in the numbers. I'm not going to read them out. That's boring. But Riverside is national, both in Scotland and all across England. The part of the business that I'm responsible for, care and support, makes up about £110 million of that turnover. Around 12,000 of the units and about 1,200 of the overall employees. So that's Riverside. So care and support, we do a range of different things. We've got our homelessness services. We also have specific services for veterans, both accommodation-based and advice services. We've got retirement living. Stock, we've got a number of care and extra care services, and also the National Portfolio Management Team. In old speak, that's managed agents. So that's where we own the properties, but a different provider provides either care or support from them. We've got about 10,000 units of accommodation in our accommodation-based services, but we've also got around 3,500 customers of non-accommodation based services, predominantly floating support and some outreach services as well, and about 2,000 units that sit with the National Portfolio Team. We do have a number of housing first services dotted across the country. We're also involved in 2 of the 3 large scale MHCLG funded pilots for housing first. Although the minute you call it a pilot, it ceases to be high fidelity, just an opinion. Just thinking about housing first, wanted to make this point. We did a piece of research recently with York University on commissioning trends called traumatized system. And it was interesting to hear what Seini had to say in relation to, you know, the realities of finding self-contained accommodation for every customer group, because we think it's really important to highlight that to truly have an opportunity to end homelessness, or certainly to end chronic sleeping, we need a range of provision, not just housing first. It needs to be high quality hostels, housing led services, housing first, a range of different services. I'm going to get off my soapbox. So I'm going to focus really on a slightly different aspect than Seini did, and I'm going to look at the why. I think we all understand kind of like the moral argument, and we know that using positive psychological approaches works, but I think that it's also really important to understand the why. So there's a load of evidence out there across Europe that shows that adversity can not only predispose people to experiencing periods of homelessness and multiple forms of disadvantage, but it can also create barriers to people's recovery. It's widely accepted that trauma can really influence the way that people regulate their emotions, cope with challenges, and form or sustain relationships with other people. And that, of course, includes the relationships that they have with us as service providers. Now, there's a really interesting piece of work that was done by a guy called Dr. Adam Burley, looking at the fact that the work that we do is relational in nature. It's one group of people, the customers, who have a series of needs that need to be met, forming a relationship with another group of people, us, in a dynamic relationship that centres around people's need for the provision of care and support. Now, quite often he goes on to talk about the fact that quite often when people display their histories and their experience of trauma and communicate those in such a way that others can find distressing, or if they are viewed as failing to engage in the way that we think that they should be engaging with us, that can be, and all too often is, that results in them being excluded from services. So then the cycle of rejection and confirmation of the fact that, you know, services can't be trusted continues, and then just exacerbates people's who are already vulnerable, exacerbates their mistrust in services and their unwillingness to engage with us. Seini also mentioned ACEs. I'm going to go off script here. It's easy for me to remember the acronym for this because my husband happens to be called Ace, which is a strange coincidence. I'll just throw that out there. But we know that a really high proportion of people who have or are experiencing homelessness have experienced some form of adverse childhood experience that impacts on their ability to be able to form positive relationships and therefore engage in a process of support with us. Now, the best data that we have is comes from the multiple exclusion and homelessness study, which involved in-depth surveys of 452 users of relatively low threshold services in 7 cities. This showed that sexual and physical abuse before the age of 16 had been experienced by 23% of the respondents. 27% witnessed violence between partners or carers. As many as 24% reported having at least one parent or carer with a drug or alcohol issue. And a total of 15% reported that they hadn't had enough to eat at home during childhood. Now, as providers, sometimes we can be guilty of assuming that everyone can just engage with us in the way, in a way that's straightforward and anxiety free, when in fact some people can be really quite phobic, quite scared of engaging in support, even though they may recognise that they really would benefit from it. So as a consequence of this phobia or fear, they can come across as being ambivalent or dismissive or disengaged. Now, all too often we have interpreted this as someone being a non-engager. We hear that term all the time, non-engagement. But as we've seen more of an appetite within services to start to think differently and really understand the psychology of homelessness, and really start to understand things like the impact of adverse childhood experiences and trauma, there's more of an appetite for recognising that we need to do things differently. Across a number of sectors, in fact, we're seeing really positive impacts from using positive psychological approaches, which includes increased levels of engagement, reduced evictions and abandonments, increased positive outcomes, and a reduction in incidents. An organisation called Evolve Housing and Support, I'm not sure if there's anyone from Evolve on, where I used to work, did a piece of research looking at the experiences of their customers in relation to trauma, but also as well the impact of their move from having a very traditional deficit-based model to an asset-based model. And they go on to say that their asset-based approach to support is demonstrating that by focusing on an individual's strengths instead of their deficits, along with providing customers the right kind of support and opportunities in a timely manner, that they can break the cycle of trauma. And in Westminster, we've been part of a research pilot looking at the impact of PI as well, and using the Health of the Nation outcome scale, which looks at areas of distress and functioning, and we saw significant improvements between the first record and the second record, with really noticeable improvements in depression, self-harm, agitation and aggression, substance misuse and other symptoms such as anxiety, relationship problems and activities of daily living. Seini talked about a number of these, I think, in relation to the things that make up an overall positive psychological approach. And there are things that we know and we talk about quite often, such as asset-based support, trauma-informed care and psychologically informed environments. There are other examples, such as positive behavioural support, which we use in our care and extra care services. I wanted to shout out for Homeless Link. Like, Homeless Link have a model to reduce evictions and abandonments that probably predates before we all started talking about asset-based support planning. The basic premise of it is that when an incident occurs, the response should be working with the customer to understand the cause of the behaviour, and then in conjunction with the customer, coming up with a response that is designed to address the cause of the behaviour, rather than what the traditional model is someone does something against the rules, you give them a letter saying, that's very bad, you mustn't break the rules, don't do that again, and surprise, surprise, that generally doesn't work. In relation to staff, I personally think that if you're going to start going down a route of saying, okay, we subscribe to a model where we consider the psychology of homelessness and we're going to look at customers' strengths and focus on these areas, you can't then turn around to your colleagues in one-to-one and say, yeah, we're going to continue to focus on your deficits and not your strengths. There has to be a level of consistency between the way you choose to treat customers and the way you choose to treat your colleagues as well. So with colleagues, we use reflective practice widely, also clinical supervision, as Sally mentioned earlier on. But we're also starting to focus on strength-based leadership coaching as well. So for us, the positive psychological approach isn't just with customers, it's also for colleagues as well. So our journey, now this is where I get really geeky, because as well as being fascinated by the psychology of homelessness, I'm also a little bit nerdy when it comes to culture and organisational culture. And positive psychology it's a cultural approach, and for it to be embedded effectively, it has to be you have to take the focus of it becoming part of the culture. Now, Riverside as a national organisation, our services are extremely geographically spread out all over the country. So achieving a level of consistency has to date been really, really difficult. So one of the things that we've been focusing on is the aspects of our culture that support embedding an approach around positive psychology that's consistent across the country. Now, there's a really interesting, I was going to say geezer then, there's a really interesting academic called Edgar Schein, who looks at culture as being 3 layers. You've got what people believe about the organisation or whatever it is, your stated values, and then your visible representations of culture. And they're things like policies, procedures, the physical layout of buildings, the language that you use, the training you deliver, systems, those kind of things. And if the visible representations aren't consistent with the stated values, then people will not buy in to what you say your values are. And positive psychology is very much a values-based approach to work. So for people to actually believe it and therefore embed it, all of your systems, policies, procedures, language have to be consistent with the approach. And it's fair to say we've still got quite a share of work to do in relation to reviewing all of our policies and procedures. We have a system, a CRM for support that maybe doesn't support positive psychology at the moment, which we're starting the procurement exercise to replace that hopefully in August this year. So it's been really important to make sure that all of the things that we ask our colleagues to use in their day-to-day work reflect what we're saying we want them to do. And then once we've done that, we're going to disseminate that learning to other non-care support parts of the business, social housing, our call centre staff, these kind of things. The great thing about positive psychology is it works really well with people who are experiencing homelessness, who have complex needs, not because they're experiencing homelessness or not because they have complex needs, but because they're people. And it works well with everyone. There are some things that we won't be able to resolve as an organisation, which I try and talk about as often as I can. There are some things, especially in supported housing, that are structurally built into the sector, specifically conditionality. So the fact that someone needs to actively engage in a process of change to retain the accommodation, and arbitrary length of stays. And both of those things create an environment where you are trying to force people into a process of change that's right for the contract and not necessarily right for the individual. And it works on the principle that someone is in a position to be able to engage in a process of change at the same time that they're in housing need. And those two things don't always align. But by using positive psychological approaches, you can really mitigate the impact of those two structural things that we haven't been able to influence a change of yet. But I'm going to keep going on that one. But why is it really important? Do you know, I often tell this story as to why or how the penny dropped for me, just how important some of these things are. When I was working for a previous organisation, we had a customer who very sadly passed away. And as was the normal practice, I conducted a case review, you know, looking at all of the work that we'd done with that person in the 3 years, I think, that he'd been living with us. And I really went into a huge amount of detail on all the records that we had, and I built up what I thought was a really, really good understanding of who this person was, not having ever actually personally met him myself. And he was a person of needs and risks and challenge and difficulty. And then I went to the funeral. I went to this the customer's funeral, and his dad got up and gave a eulogy. And he spoke about someone who had passions and skills and desires, and he described a person that we didn't know. And it struck me at that point that that was wrong. That was really wrong. We should know the whole of the person and not just the things that make them a challenge or make them complex. And that's for me why it's really important. This is about people, and this is about treating people with dignity and respect. And this is about recognizing that there is more to people than a collection of needs and risks. And that's me. So happy to hand back to Vicky now.
Thanks, Lee, and thanks for ending on that quite moving account of one of your customers. I think it really brings it home. But you know, some of the things that stuck out for me in your presentation were, you know, about the whole organisation approach, the strengths-based leadership, coaching, but also the fact that you know, some of the structures of supported housing are difficult to work around, but it's helped to mitigate you know, what the constraints that you're within, really having a pie approach within the organisation. So I think so thank you, that was excellent. We have we are approaching 12, but hopefully if people are willing to sort of hang on, we can spend 10 minutes answering some questions. I do believe that there is someone who's actually put their hand up to ask a question in person. So I thought I might kick off with Tim Whiteside. If you're still here, I can allow you to talk. So I'm going to do that now, and hopefully you'll be able to ask a question. You have to unmute yourself.
Hi, everybody. I stuck my hand up at the beginning only because I wanted to say hello to everybody.
Hi.
But
hello, Tim.
I have got a question. I would like you to go over again the bit. The ACE acronym, Adverse Childhood Experiences. Could you repeat what you were saying about that?
Shall I go first?
Yeah.
I think what we've started to really over the last few years is that trauma plays a huge part in relation to people becoming predisposed to experiencing periods of homelessness. Primarily because it would seem to impact on people's ability to be able to form relationships. I'm going to put my own spin on it here, because this is, you know, with my layman's kind of like mind, this is how I understand it. And for me, it would seem that the crux is about trust. And I think if as a child you experience situations where you should have been able to trust a grown-up and they've proven that they haven't followed through on that trust, I think that then causes issues with people's abilities to be able to trust in other people as they grow up. And because the work that we do should always be based on a trusting relationship. If you think about it, we ask our customers in homelessness services to take huge risks. We're asking them to change. And when someone changes, there's the risk of failure. And then there's the risk of the psychological impact of failure on a person. Change, going through a process of change for all of us, it is a risk. And we ask customers to take those risks all the time. And for that to work, they need to be able to trust us.
Right.
Trust is just so critically important.
No, that I can completely relate to that. Trust is so important to build trust in the early stages. I think today what's come across more than anything is the focus on strengths. You know, that's what it needs to be done more than anything else, is to focus on the strengths of a person rather than you know, what could be done better. If you see somebody, you know, well, that's my view, and yeah, thank you for reiterating that fact, because it's made it clearer. I've found a lot very, very useful indeed. I'll
Thanks,
say
Tim.
goodbye now. Thank you.
So I just muted myself there. Thanks, Tim. There's some questions we've got in the chat box. Quite a few actually. So I will ask a question from Spiros Georgiou, who's actually from Hightown, because I know that we're putting some PI approaches into our services as well. And Spiros asks, how can homelessness and housing related support organisations positively influence the PI/trauma informed way of working to their local commissioners, and particularly if commissioners have a hardline traditional approach to evictions and abandonments? I don't know if Seini, would you have a view on that?
Okay, so how can we, how do we, I mean, it's about reflecting the benefit that they gain. And I think that Lee, you know, touched on the kind of, and certainly Vicky, about how, you know, our aim is to sustain people in accommodation, to give them appropriate support and to enable them to go on to prevent them coming back around. And so in terms of commissioning these services, it seems like it's a proactive way of being able to ensure that we prevent that revolving door. And so kind of giving them the benefits. I will say that we work with, I think we worked with a consultant employed by Homeless Link to develop some more information for other housing providers, and we around commissioning services, and we felt very much that there needed to be more information for local authorities as well, because we find that actually there are often local authorities that are commissioning, asking for psychologically informed practices, but actually in the way that they want us to work, and the tools that they ask us to use are actually more opposed to us achieving that working. They want us to fill out or follow particular processes around things like assessment and filling out certain forms. And so I think there is a big piece in terms of educating commissioners about what it really means to be able to enable us to work in the way that we want to work.
Yeah. Yeah. I would agree. I'm going to do another shameless plug for the piece of research that we just published recently, the traumatized system. One of the things that highlights is the disconnect between the things, the language that commissioners use when they're tendering a service versus the structural aspects of the things that they expect, you know, because they will say, we want asset-based support services with Pi implemented, but then the actual structure of the contract is completely at odds with those principles. I think that's one of the things that we really want to call out. So Google Traumatized System, it's a great piece of work. It's a really easy read.
Thanks, Lee. We've got a question which has been upvoted from Kirsten Foy, who says, I'm interested in some examples of training given to frontline staff around psychological approaches. And I'm really pleased to see your organisations offering clinical supervision, something I've always thought was missing from support services, despite the situations our tenants live with and discuss with us. So I don't know if that's something perhaps we can share after or now. I don't, if there's any organisations you've used that we can share with others.
So in terms of examples, I mean, we went via Homeless Link, and we went and had a conversation about what we felt, where we were and what our needs were, and they were able to link us to a number of different training consultants, and we spoke to some of them, and then were able to select those that were most aligned to, I think, what we were trying to achieve and from where we were at. So Homeless Link was a great starting place for us.
Lee, do you have anything to add?
I would agree. I would just say, sorry. I would just say in relation to clinical supervision is not cheap. And it's something that we fight every year to keep in our budgets. But whilst not as effective as one-on-one clinical supervision, I think reflective practice groups, which can be facilitated internally, also bring a huge amount of value. If staff have a space where they are guided through a discussion that thinks about, okay, what was the impact of that on me? How did we respond? How could we respond differently? Also brings a huge amount of benefit. So clinical supervision is the apex, but reflective practice sessions can also provide huge benefit to colleagues who are dealing with sometimes really emotionally distressing situations.
And they're the preventative element as well, aren't they? That reflective practice, it also kind of steers people away from that real kind of crisis moment of the experience of vicarious trauma. So yeah, right, I really agree with what Lee's just said.
Thanks, guys. I think we just got room for one more because they asked the question first. How do you get Wi-Fi in through a charity? We're trying to get this for tenants, but it's about affordability, I think. Any ideas or advice on that?
No, I mean, we're very fortunate within Sovereign that when I talked about kind of having the right people on board and getting that influence across the business, we were able to talk to our we were able to influence that the IT our own IT would install the Wi-Fi and that would be funded and it wouldn't have to be service charged to prevent that from being to create issues around affordability. I mean, my only other suggestion for that would be through service charging, but I accept that there are challenges with that.
Yeah, and it's not as straightforward because some aspects of it aren't service chargeable. I try not to wrap my head around what is and what isn't service chargeable too much because my head would just implode. But we've secured funding over the next 3 years to upgrade 300 of our supported housing bedrooms to a consistent standard. It's a huge amount of investment, and we've been consulting with customers in relation to the things that are most important to them, and Wi-Fi has come out very clearly as being a priority to customers. But we are currently in the process of how we fund that without making service charges unaffordable. And what you would do if someone said, well, I don't want Wi-Fi. You know, it's such a complex area. Once we have the answer, I'll be happy to share it.
Okay, thank you. I think, well, it's 12:10, so I'm conscious that we've sort of gone a bit over time, so we probably need to wrap up. So I'd just really like to thank Lee and Seini again for their excellent contributions, and thank you everyone else for attending. I hope you found this session useful. We have been asked whether we'll be sharing the slides, which we will. They'll be available on the Homes for Cathy website, but I'll also email them to all attendees. And also the film that Seini, well, I tried to show, which perhaps the sound quality wasn't particularly good, so sorry about that, but I can send you the link to that. And if you have any questions that you want me to direct to Seini or Lee, or put you in touch with anyone, then feel free to email me, and yeah, I can try and help as much as I can. So yeah, thank you everyone, and I will end the workshop.
Thanks, Vicky.
Thank you.
Thank you, take care.